game of scones or diabetic prevention?
Hello, I'm Natalie Kunsman, MD, and today we are going to understand diabetes, and it is not a game of scones. So we're going to not only understand it, but we're going to try to prevent it. So the first thing is how weight contributes to diabetes. And one thing that we do know is being overweight is a big risk factor for type 2 diabetes. However, you don't actually have to be overweight to develop type 2 diabetes. Now, the fat distribution is important to understand because if we have a tendency to have abdominal and truncal weight, that is a much higher risk of type 2 diabetes than if you have it stored in the hips and the thighs. And if you are a man, you're at higher risk for developing type 2 diabetes if your waist is 40 inches or higher, or for a woman if you are 35 inches or greater. So there are also other contributors to diabetes, and one of them is also inactivity. So obviously the less active you are, the greater your risk of type 2 diabetes. And physical activity not only controls the weight, but it also uses up some of the glucose, which is one of our energy storage molecules, and it makes our cells more sensitive to the insulin. There is the family risk factor, so that if your family carries a history of type 2 diabetes, you are obviously much higher rate at contracting it yourself, but in particular if your sibling has type 2 diabetes. And I would venture to say that you are inheriting a genetic pattern that makes glucose hard to process. So I sometimes tell my patients, if you have a propensity to have a very difficult time to manage your carbohydrates, it's almost a poison to you. Race, although it is really unclear why, there are certain races that have a higher risk of this, such as if you're Black, Hispanic, American Indian, or Asian American, people are more likely to develop type 2 diabetes than Caucasian people are. If you are 45 or above, you are much higher risk for developing type 2 diabetes. And we think some of that is related to the activity level going down as we age. But we're also starting to notice that type 2 diabetes is getting a lot more prominent in our adolescent and toddler related patients. Type 2 diabetes is common in a pre-diabetic picture, such that sometimes your insulin levels may be dramatically elevated for many, many, many years until you truly manifest yourself as a type 2 diabetic. And the gestational diabetic, which is the pregnant woman who develops diabetes, is at least 60% higher of developing type 2 diabetes in the adulthood. If you have polycystic ovarian syndrome, which is also characterized by some hirsutism, irregular menstrual periods, and hormone irregularity, you are much higher risk for developing type 2 diabetes. Now, as a small little sidebar, type 1 diabetes is a very specific term when there is an autoimmune process such that the pancreas is under attack by antibodies. So it's an autoimmune phenomenon, and that abruptly stops the pancreas from making any insulin. And these patients are of a different caliber. They're typically thin, they are typically young, and they will always need insulin to survive. But their receptors and their livers are intact. So the body typically, for a while, will be good at handling the insulin that they are prescribed. So type 2 diabetes has a whole cascade of events and multiple issues. So what exactly is happening to the body with type 2 diabetes? Well, the cells can use sugar as fuel, and then that fuel has to go into the cell and get to the mitochondria to make energy production. And we have receptors outside of the cells that will bring the insulin in. So as the more and more sugar is floating around, and the cells are going to make more and more receptors to try to bring the extra sugar in, but after too much sugar, the cell can get so saturated that even those receptors no longer can take the excessive sugar, and then they become resistant to the insulin trying to bring the sugar in. So that would be insulin resistance. So that sugar is left floating around in the bloodstream, and that is the sugar that we are measuring when we poke our fingers to check a glucose level. Now, the liver also releases sugar in our fasting states, such as nighttime when we sleep. So this also becomes faulty after a while in these obesity states, and the liver starts releasing excessive amounts of sugar at nighttime. And this explains why so many people will have high sugars in the morning when they've already been fasting all night long. Then, of course, there is the pancreas that secretes insulin, and the pancreas can just simply poop out after cranking out so much insulin with so much carbohydrate and sugar intake that a patient just may wind up after a while needing insulin because the pancreas cannot keep up with that demand. So why does diabetes create all the havoc that it does? And why is it so life-threatening and such a high-risk condition that can cause death? Well, very, very simplistically, I like to tell patients that the red blood cells and the A1C is actually measuring the glucose that is on the red blood cell, and that measures the severity of the diabetes, and it is what contributes to our heart disease, stroke, and high blood pressure. So they are actually measuring how crystallized the red blood cell is. And in my mind, it reminds me of a cat of nine tails that's trying to squeeze through these tiny little capillaries instead of that red blood cell being very smooth around the outside. These glycosylated or sugar-coated hemoglobin cells are very sticky and traumatizing to those little arteries. And I would like to say, almost as a sidebar, that the rest of our body is crystallizing as well. So it's not just the hemoglobin molecules, but that is what we have as a measurement tool that has had a lot of standards with it to understand it. So a diabetic patient, for instance, will have a lot of crystallized bones, for instance, arthritis. So most of the damage in diabetes is relating to those tiny little arteries getting damaged. So we're talking about retinal troubles, we're talking about cataracts, we're talking about some of those heart vessels and heart arteries, which are supplying the heart of its blood supply, which can lead to heart disease, stroke, and high blood pressure because those narrow vessels are atherosclerotic. We also can get, or one can also get nerve damage or neuropathy because of the blood supply going to those tiny little nerves, and those nerves are having some crystallization, and that may give the sensation of burning, tingling, numbness, pain that is in what we call the stocking and glove distribution, so that it will spread from the distal tips and make its way up as in a glove or as in a stocking distribution. Now, damage to those nerves can also have some internal nerve damage, which can cause some gastroparesis, which can cause problems with nausea, vomiting, diarrhea, constipation, and for the men, erectile dysfunction, because it's affecting those capillaries as well. The body can get kidney damage because of those tiny vessels that supply the kidney, and that can be irreversible. And when that gets severe, a patient may have to undergo dialysis since the kidney can no longer clear the toxins. We can get serious eye trouble, such as the cataracts and glaucoma, but also micro damage to the retina, potentially leading to some blindness. The skin can be slow healing, such that if we have cuts to the dermis and epidermis, they may heal poorly. And when that is severe, that can lead to amputations and foot infections. A diabetic patient also has a higher rate of hearing impairment, thought to be related to the microvasculature going to the cochlea. Diabetes may lend itself with more of a propensity for bacterial and fungal skin infections. There's also a relationship that obstructive sleep apnea is common in people with type 2 diabetes. And obesity is actually a main contributor of both conditions at the same time. So sometimes treating that sleep apnea may lower some of your blood pressure, may make you feel more rested, and in that regard may actually help some of the blood and sugar control. Here we go. Again, Alzheimer's disease, highly associated with type 2 diabetes. And we're not exactly 100% sure what is the clear etiology and the direct connective pieces, but research is starting to identify some of those. So, the best treatment of diabetes is prevention. So how can we prevent diabetes? And again, the out and out treatment of diabetes and the medications and how to go about that approach will occur at later video casts. So cut out junk food and processed food. Avoid being sedentary. Work out regularly, and in the very least, we are talking about at least 30 minutes a day of aggressive walking or developing a sweat and some good cardiovascular activities at least 5 to 7 days a week. But the body would prefer a lot more than that because we were born for movement. Very low carbohydrate diets and those that are ketogenic have been studied for prevention. Get your sources of carbohydrates from the beans and the veggie family, and not the highly processed grains. Therefore, we need to be low or no grain. We want to drink water as the primary source of our fluid intake, so there is no need for fruit juices, milk, high carbohydrate beverages such as soda, beer. Lose weight if you are overweight. Quit smoking. There is a high association between smokers having a much higher rate of developing type 2 diabetes. Be careful of your portions while you are eating. Now, interestingly, drinking coffee and tea, and we think this is some of the polyphenols that are the protective ingredient, but I would say keep your fixings low. Drinking coffee or tea actually is studied to be staving off type 2 diabetes. Now, there are a few herbs and supplements such as curcumin, chromium picolinate, dandelion, bitter melon, and a whole host of others that may help you become more insulin sensitive. And as I said, medication and treatments is a topic for another day. So, you will not die of a bread, ice cream, pasta, or scone deficiency, so eat wisely. Again, I'm Natalie Kunsman, MD. Subscribe to my channel below so you can understand a whole breadth of integrative topics that I've previously discussed and we will discuss in the future. And until we meet again, be well.